Manager of Compliance, and today we're going to talk about the final HRA rules that allow individual coverage HRAs to be integrated with individual coverage. And we're going to talk about how to integrate those HRAs with Medicare. So as a broker, you probably have a lot of clients who are asking you about these rules because they have employers that are small employers, and they'd like to get off their Medicare entitled employees off of their group health plan and onto Medicare. And they can do this with this new arrangement, but there's a lot of requirements that they must meet, and it's not just simply offering them this plan and getting them off their group health plan. So in June of 2019, the Department of Treasury, the Department of Labor, and the Department of Health and Human Services released their final HRA rules, which took effect in August of this year. And the final rules expand the use of HRAs in a couple of different ways. The first way is it removes the prohibition against integrating an HRA with individual coverage. The second thing that it did is that it created a limited accepted benefit HRA. So basically these final rules created two new HRAs, an individual coverage HRA and an accepted benefit HRA. For the purposes of this speech, we're going to focus on the rules dealing with individual coverage HRAs, and we're going to focus on how to integrate those with Medicare. So starting January 1st, 2020, an employer can offer to its employees an individual coverage HRA that's integrated with individual coverage, and this includes Medicare. So before we go further, we probably should define what Medicare is. So Medicare is health insurance for the elderly and for people with disabilities, and it's administered by CMS, or the Center for Medicare and Medicaid Services. Now people can be entitled to Medicare a few different ways. There's age-based Medicare, so if you are 65 years old. There's disability-based Medicare, which if you are receiving disability benefits under the Social Security Act or the Railroad Retirement Act. And then also you can be entitled to Medicare by having end-stage renal disease. Now there's four parts to Medicare. There's Medicare Part A, which you can think of your inpatient hospital services coverage. And an individual can be automatically enrolled in Medicare Part A if they are receiving Social Security, if they have applied for it and are receiving Social Security. Now Medicare Part B applies to outpatient services. So an individual can be automatically enrolled in Medicare Part B if they are entitled to Medicare Part A and they don't decline enrollment in Medicare Part B. The third part of Medicare is Medicare Part C, or as it's commonly referred to as Medicare Advantage. This coverage is offered by private insurers, and it consists of Medicare A and Medicare B. And an individual can enroll in this Medicare Part C if they are entitled to Medicare Part A and Medicare Part B. And finally, there's Medicare Part D. Now Medicare Part D is prescription drug coverage, and an individual can enroll in prescription drug coverage if they are entitled to Medicare Part A and Medicare Part B. So now with that background knowledge, an individual HRA can be integrated with Medicare if an individual is entitled to Medicare A and Medicare Part B or Medicare Part C, which again is Medicare Advantage. They can use the HRA to reimburse medical expenses for their premiums to Medicare. Now this can be Medicare A, B, C, or D, and can also include Medigap policies, as well as expenses under Section 213D of the Internal Revenue Code, which are called qualified medical expenses. And these expenses are generally for the cure or treatment or diagnosis of a disease. Now, when you're using an HRA to move individuals off of Medicare, you have to think about the Medicare secondary payer rules. Now, this is a rule that generally applies to employers with more than 20 employees. This rule states that you cannot incentivize your employees who are Medicare entitled to decline enrollment in the group health plan and move on to Medicare, because this creates more expenses for the Medicare program, which already has way too many expenses as is. So however, under the final rules, if you're offering an individual coverage HRA that's integrated with Medicare, those Medicare entitled employees are required to enroll in that HRA, which is the group health plan. Therefore, the employer is not incentivizing an employee to decline enrollment in the group health plan because they're required to enroll. I want to thank you for your attention to this part one of the presentation. In the next part, I will be going over the non-discrimination rules that employers are required to comply with. Thank you.